The common image of ADHD is a hyperactive boy. This stereotype is hiding a massive part of the story. For girls, undiagnosed ADHD isn't about poor grades. It's linked to a much higher risk of self-harm. Why? Their symptoms are different. They turn inward, creating silent battles with anxiety and depression. They become masters at hiding their struggles, sometimes with perfectionism, masking the inner chaos. We will show the real signs of ADHD in girls, why they are missed, and how to get the right help. So what is the fundamental difference? While boys often show external hyperactivity, a girl's ADHD is mainly inattentive. This isn't daydreaming. It's a chronic struggle to finish tasks, constant forgetfulness, and losing things. These behaviors are quiet, they don't disrupt the class, so girls are far less likely to be referred for evaluation. Instead of being seen as having a neurodevelopmental disorder, their symptoms are mislabeled, lazy or spacey. Hearing these labels repeatedly has a destructive impact. They start believing they are fundamentally flawed. This continuous struggle creates a powerful need to compensate. So, how do they manage to hide it? Girls are often socialized to be people pleasers. This pressure drives them to mask their symptoms to appear normal. A frequent mask is perfectionism. She might spend 3 hours on homework that should take 1, checking for mistakes. This constant effort of hiding and fear of being found out is mentally exhausting, creating fertile ground for anxiety. A doctor might diagnose the anxiety but miss the underlying ADHD causing it, treating the smoke but not the fire. But another biological factor makes symptoms more confusing. What happens when hormones get involved? First, let's examine social behavior. Because hyperactivity in girls doesn't always mean physical motion. It can be hyperactivity of the mouth, being extremely talkative, dominating every conversation. It can be verbal impulsivity, frequently interrupting others or blurting out thoughts without a filter. This creates social difficulties, making it hard to form friendships with peers who don't understand. Hyperactivity can also be emotional, intense reactions that seem disproportionate, often labeled too sensitive. Now, imagine handling all of this, and then your body adds a complication. Back to the hormone question. Hormonal shifts during puberty can dramatically worsen ADHD symptoms. Estrogen helps regulate dopamine, a key neurotransmitter. When estrogen drops before a period, ADHD symptoms can spike. Adults might dismiss this as teen drama. For the girl, it feels like an emotional roller coaster, making it harder to manage school and friendships. And this is not something most just grow out of. Many continue to face impairing symptoms well into adulthood. So we have hidden symptoms, masking, and hormonal chaos. What happens when these combine over many years? Remember how symptoms are mislabeled as laziness, that external criticism becomes an internal belief of being broken. The exhaustion from constant masking leads to burnout. Without proper support, some turn to negative coping mechanisms. The internalized stress can manifest physically, contributing to eating disorders as a way to control the inner chaos. This brings us back to our start. Low self-esteem, depression, and isolation. This is the pathway to self-harm. Knowing this isn't about fear, it's about inspiring action. So, what is the path forward from here? The first step is accurate diagnosis. It requires professionals and parents to look past stereotypes and gather a detailed history. Treatment is effective. It often includes medication, therapy for building skills, and accommodations at school. By seeing the signs, not the stereotypes, we can change the future for millions of girls. Share this video to spread awareness.